Dr. Pettit, one quick question occurs to me. Why does a person go into this kind of work?
The field of veterinary medicine is big enough that there's something to appeal to almost everyone. It has challenges and opportunities for a variety of applications. We've seen some of them in our tour through the hospital. People can specialize in radiology, laboratory work, and so on. For me, though, I think the greatest satisfaction is the pleasure I get in seeing people having their pets return to them healthy and well once more. Hello, Mr. Potter.
Hello there.
This is Mr. Potter from Viola, Idaho. His dog Red has been in the hospital for a week or so for treatment of a broken leg. You can see the incision healing here where the surgical repair was made. We put a stainless steel pin inside that bone, and we plan to leave it for at least 6 weeks until the fracture heals. Mr. Potter, we'll want to see Red in about 2 weeks to see how this is coming along. So if you could bring him back then, well, we'll be happy to check his progress.
All right, thank you.
Bye, Mr. Potter. I'm standing in one of the examination rooms in the hospital. We have 3. This is a little bit larger than some of the others because it contains some special equipment. Any animal has to be examined before it's to be treated or hospitalized, and so an examination begins by placing it on a table such as this. The shiny stainless steel is on purpose so that the animals will feel a little bit uncertain about their footing and a little bit more cooperative. Now, all examination rooms contain a certain minimum equipment, thermometers, stethoscopes, and so on, and this is stored in the cabinets that you see in the back of the room. There, a microscope on the counter in the back is used for examining skin scrapings, looking for ear mites, external parasites, and the like. The other piece of equipment in the back is specialized. That's called a slit lamp. It casts a very narrow beam of light and is used for detailed examination inside an animal's eye. These 2 cabinets in front of me are much more specialized equipment. This little one directly in front is an electrocardiograph, which I'm sure you're familiar with. It measures the electrical impulses of the heart. And dogs do have a great deal of heart trouble, particularly as they grow older. It's not used in routine examinations, but again reflects the specialized examinations and care that can be given at a university hospital. This larger machine on my right is even more complicated. It has several names. It might be called a physiograph or a polygraph. It does what the little one does, measures the electrical impulses of the heart. It also will measure the electrical impulses in the brain, an electroencephalogram. It will record pulse, heart rate, and a number of other detailed body functions, recording them electronically on the graph paper. We like to think of it as a medical lie detector. We're now looking into one of the small animal operating rooms. This illustrates that all of our surgery on dogs and cats is done aseptically or sterilely. The surgeons are wearing caps, masks, gowns, gloves, and the field is draped with sterile towels and drapes. It also illustrates one of the major features of the university hospital, that it is a teaching hospital. Surgery here of a routine type is done by senior veterinary students after they have completed the prescribed courses in surgery which qualifies them to do this sort of work. And so you are watching 2 senior veterinary students performing abdominal surgery on a dog under the careful supervision and observation of a faculty member, who in this case happens to be Dr. Jack Alexander, who is also our radiologist. The cages you are looking at are on one wall of a room which doubles as surgery preparation and a recovery ward after surgery. From this room, doors open into the operating rooms themselves, into the scrub room where the surgeon scrubs his hands and arms before surgery. After surgery, the animals are kept in these cages while they recover from anesthesia and while they need more intensive care than they do at any other time. So this room then is a center of activity for much of the work that goes on in the hospital. Part of the equipment that's in this room includes an oxygen cage. This plastic door cage on the end, you can see, is piped from an oxygen outlet in the wall. The hospital has piped oxygen throughout. There are oxygen outlets in all of the wards and the operating rooms as well as here. And by adding ice to this to keep it cool inside, we can make then an oxygen tent for animals. We've included here for you to see a sample of an anesthesia machine. This also operates from the piped oxygen system and could replace the outlet for the cage there. We can give a variety of inhalation anesthetics with this machine, although the one that is used most commonly is ether. We can either use a mask over the face of a dog, and here's an example of such a mask, or as is more commonly done, after the dog is once under anesthesia, we put a tube down his windpipe and let him breathe through that, eliminating the need for the mask. Much dog and cat surgery is done by anesthetics that are given by an injection into the vein, however, so that this equipment is not used on every case that is treated. We're standing in the treatment corner of one of the wards in the hospital by a treatment table near the medicine cabinet in a general medical ward. Not all of our patients can be treated as outpatients in the examination room, and many of them have to be hospitalized for more detailed treatment, continuing therapy, perhaps fluids, other procedures that cannot be done in the examination room. Here to tell you about this part of the hospital and what goes on is a member of our staff, Dr. Jack Robinette.
We're standing in what we call the general ward. This ward is typical of some 6 different wards in the hospital, but this is one where we keep animals that do not transmit their diseases to others, such things as stomach upsets, fighting, and so on. We have several cages in here. If you can see down here, we have one set up for intravenous feeding to the animals when they are not always able to take their medicine by mouth.
Now that we have seen the general ward, we're going to follow one of our patients to X-ray. This dog, a Brittany Spaniel, has been entered into the hospital for X-ray examination of its hips to see if they are normal in structure. In order to position a dog for such an examination, it's necessary that he be tranquilized because we have to put him on his back and pull his legs out to a position that some dogs find uncomfortable. Dr. Robinette is giving an injection of a tranquilizer, which will not completely anesthetize this dog. We'll take the starch out of him, make him tranquil, calm, and quiet for the X-ray examination, which is to follow. A few minutes to take its effect, and the effect will last anywhere from 1 to 3 hours, depending upon which drug is used and the dosage that is administered. We are now standing in the X-ray room, which serves the entire veterinary hospital. I'd like to have you meet our radiologist, Dr. Jack Alexander, who will explain the functions of this department.
Thank you, Dr. Bennett. Currently, this facility is designed to handle both large and small animal. Here, the machine we are using is used in both large and small examinations, and as you can see, the machine is readily moved so, and up and down on a telescoping tube. Now over here we have a stanchion for our large animals, and as with small animals, restraint is a problem in large animals, so that our horse comes in and stands in the stanchion. Ahead of the stanchion we have a therapeutic machine, diagnostic therapy, or radiation therapy. This is used frequently in thoroughbreds with periostitis, arthritis, and typical leg injuries. Now this is the control panel for our therapy machine, and since we are concerned with the safety of the operator, this control panel is behind 12 inches of concrete, and as you can see, the operator can observe the animal through this leaded window and still be protected from the X-ray.
Most of the interest in our clinical diagnostic laboratory at this institution is in hematological studies. This involves the studies of the blood. As you can see, the blood mixing on this wheel. The students, of course, are vitally interested in this aspect of the clinical laboratory because this is the phase of the clinical diagnostic laboratory which will be of great interest to them in their private practice of veterinary medicine.
The various things that we do with the blood is to count the numbers of red cells, white cells, and various chemical entities such as blood glucose, many of the serum enzymes that are elevated in various disease conditions.